Back labor isn't just a stronger version of the usual pregnancy backache, it's a distinct and often more challenging experience. Many women describe it as a pain that feels fundamentally different from the typical aches and pains associated with pregnancy. It's important to understand this difference so you can prepare yourself mentally and physically. It's a deep, constant pain centered in your sacrum, the base of your spine. This area becomes the focal point of discomfort, and it can radiate outwards, affecting your hips and even your legs. The intensity can vary, but the persistent nature of the pain is a key characteristic. Unlike typical labor contractions that ebb and flow, back labor can feel relentless, even between contractions. This lack of respite can be incredibly draining, both physically and emotionally. It's like a constant pressure that never fully releases, making it difficult to find a comfortable position or to relax. The main culprit? Your baby's position as they move through your pelvis. The way your baby is positioned plays a significant role in determining whether you experience back labor. It's all about how their body interacts with your pelvic bones. Most babies face your back during labor, but if your baby faces your front, it can create intense, focused pressure on your lower back. This is because the baby's skull, which is the hardest part of their body, is pressing directly against your sacrum. This isn't just muscle soreness from pregnancy. It's a direct result of how your baby is navigating the birth canal. The angle and pressure are different, leading to a unique kind of pain. Recognizing back labor helps you and your support team respond with the right comfort measures. Knowing what you're dealing with allows you to target the pain effectively with specific techniques. It's not a sign something's wrong, just a different path your baby is taking. It's a variation of normal, and many babies are born in this position without complications. Understanding this empowers you to manage the experience and seek relief. You can explore different positions, massage techniques, and other strategies to ease the discomfort and work with your body as your baby makes their way into the world. To understand back labor and how it manifests, it's essential to first familiarize ourselves with two key positions that your baby might assume during the final stages of pregnancy. These positions play a significant role in determining the course of labor and the level of comfort you experience. The first position we'll discuss is OA, which stands for occiput anterior. The second position is OP, which stands for occiput posterior. Understanding the difference between these two positions is crucial for anticipating and managing labor effectively. In the OA position, which is often considered the most favorable for birth, your baby's back is oriented toward your belly. This means their spine is aligned with your front, allowing for a more streamlined passage through the birth canal. In this position, the baby's chin is typically tucked towards their chest, which helps to reduce the diameter of their head as it descends. This tucked chin, combined with the baby's back facing your belly, makes for a smoother, quicker birth. When a baby is in the OA position, it's often referred to as the sunny side down position, although this term can sometimes be confusing as it's more commonly associated with the OP position. Regardless of the terminology, the OA position is generally considered ideal for labor, as it optimizes the baby's ability to navigate the pelvis. Conversely, in the OP position, your baby's back is against your spine. This means their spine is aligned with your back, which can lead to a different labor experience. In this scenario, the baby is facing your front, often referred to as sunny side up. This position can sometimes make labor more challenging. Because of this positioning, the back of their head presses directly into your sacrum, the triangular bone at the base of your spine. This pressure on the sacrum can often cause intense and persistent back labor. It's important to remember that many babies start in the OP position, but naturally rotate to the OA position before birth, often during the early stages of labor. However, some babies don't rotate on their own, and this can sometimes lead to a longer and more intense labor experience. The OA position allows the baby's head to fit more easily into the widest part of the pelvis, facilitating a smoother descent. In contrast, the OP position often presents a wider part of the baby's head to the pelvis, which can slow down labor progress and potentially make delivery more challenging. It's crucial to understand that being in the OP position doesn't automatically indicate danger or complications. It simply means that your labor journey might be a little different, and you may need to explore different strategies to manage discomfort and encourage the baby to rotate. Several factors can influence your baby's position, including the shape of your pelvis. Additionally, your muscle tone, particularly in your abdomen and pelvic floor, can also play a role in how your baby is positioned. By familiarizing yourself with these terms, you'll be better equipped to understand the information your healthcare provider shares with you. This knowledge will also empower you to actively participate in discussions about your labor and delivery plan and advocate for your preferences. It's important to remember that every birth is a unique and individual experience. By understanding the baby's position and its potential impact on labor, you can approach your birth experience with greater confidence and a sense of control, regardless of how things unfold. Picture this. You're holding a curved puzzle piece, its edges smooth and inviting. It's a piece that seems like it belongs somewhere special, a key to unlocking a bigger picture. Now you gently slide it into a matching slot. There's a satisfying click, a sense of rightness as it nestles perfectly into place. It fits smoothly, like a baby in the OA position, the occiput anterior position, where the baby's head is ideally aligned for birth, making the journey through the pelvis as efficient and comfortable as possible. Now, try forcing it in backward. Imagine the resistance, the awkward angle, the clear sense that something isn't right. It bumps and grinds, refusing to cooperate. The pieces fight against each other, creating friction and strain, just like the OP position, or occiput posterior, where the baby's hard skull presses against your sacrum. This can lead to a longer, more challenging labor. OA is like wearing a backpack the right way. The weight is distributed evenly, supported by your frame, allowing you to move freely and easily, comfortable and balanced. You can enjoy the journey, taking in the scenery without unnecessary strain. OP is like wearing it backward. The straps dig into your shoulders, the weight pulls you off balance, and every step feels like a struggle, with the hard frame digging into your back. It's uncomfortable, inefficient, and makes the journey much harder than it needs to be. That's why OA is the optimal path. It's the route of least resistance, allowing for a smoother and more efficient labor. Baby and pelvis work together in harmony. The baby's head fits snugly into the curves of the pelvis, allowing for optimal descent. OP requires more effort and causes more discomfort. It's like pushing a boulder uphill, requiring extra energy and strength. The extra work translates to persistent, powerful back pressure for you. This back labor can be intense and unrelenting. Understanding this helps you see back labor as part of your baby's journey, not just pain. It's a signal, a communication from your baby. It's a sign of your baby's active effort to be born, a testament to their strength and determination as they navigate their way into the world. The OP position causes intense back labor because the hardest part of your baby's head presses directly on your sacrum. In OA, the firm skull faces your abdomen, cushioned by soft tissue. In OP, it's bone on bone, creating a deep, grinding ache that rarely lets up. Uterine contractions in OP push the baby's head harder into your sacrum, often without helping it flex or rotate. This can make labor feel longer and more exhausting. The baby may need to rotate during labor, requiring more contractions and effort. That's why support and pain management are so important with back labor. Your sacrum is packed with sensitive nerves that branch into your pelvis and legs. In OA, the baby's head glides past these nerves with little pressure. In OP, the hard skull presses directly on the sacrum, sending powerful pain signals. This pain is neurological, not just muscular, and can radiate into your thighs. The pressure often remains even between contractions, making it hard to rest. Understanding this helps you target comfort measures, like shifting positions to relieve nerve pressure. It's not a sign something's wrong, just anatomy at work. You have options for managing back labor. Move and change positions often. Hands and knees can relieve pressure on your sacrum. Counter pressure is key. Have someone press firmly on your lower back during contractions. Use a tennis ball knuckles or the heel of a hand for relief. Hydrotherapy, warm baths or showers, relaxes muscles and eases pain. Try pelvic tilts leaning forward or asymmetrical positions to help your baby rotate. Listen to your body and experiment with what feels best. Every movement can help your baby find a better position. You're not powerless. These strategies can make a real difference. Facing back labor can be daunting, but remember, your body was made for this. Back labor is just one variation of normal birth, not a sign of failure. Understanding what's happening gives you power and confidence. Communicate with your support team. They're there to help you through every moment. Trust your instincts and lean on those around you. Your baby is working with you, and every contraction brings you closer. You are stronger than you think, and this intensity is temporary. Soon you'll be holding your baby, and the journey will be worth it.